Welcome to our session on dual eligibility. My name is Aaliyah McKinley, and I'm Director of Community Outreach and Education at the Asclepius Initiative. First, I want to welcome you to the Asclepius Initiative. You might be wondering about our name, as it certainly is unique. Asclepius comes from Greek mythology, and it represents medicine and healing. And our goal of the Asclepius Initiative is to raise awareness and promote change to make continuous, high-quality, affordable healthcare coverage a reality for all. Medicare is the federal healthcare program for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease, which is permanent kidney failure requiring dialysis or a transplant, sometimes called ESRD. Medicaid provides free or low-cost health care coverage to qualified people of all ages with low incomes, including children, pregnant women, older people, and people with disabilities. With Medicaid expansion in Kentucky, it is available to adults age 19 to 64 with incomes up to 138% of the federal poverty level, and to pregnant women with income up to 200% of the federal poverty level. Some of you may be dual eligible. This means you qualify for both Medicare and Medicaid. So, when a person meets criteria for both traditional Medicare, Part A and Part B, and Medicaid, they are considered dually eligible. For those who are dual eligible, Medicare always acts as the primary insurance, while Medicaid steps in to fill the gaps, helping to pay for costs that Medicare doesn't cover, such as premiums, deductibles, and coinsurance. Think of them as two puzzle pieces that work together to pay for your healthcare expenses. Many dual eligible individuals have multiple chronic conditions, behavioral health needs, and or long-term services and support needs. While all dual eligible individuals have Medicare and some Medicaid benefits, their level of benefits may vary. Dual eligible beneficiaries, sometimes called duals, are enrolled in Medicare Part A and or B and in Medicaid and or in Medicare Savings Programs or MSPs. MSPs cover costs such as Parts A and or B premiums and Part A and B deductibles, coinsurance, and co-payments depending on the program. They may also help to cover prescription drug costs. While Medicare is administered by the federal government, Medicare Savings Programs are through your state, and the income qualifications can vary state by state. We'll talk more about MSPs in a moment. How it works: Medicare pays first when you're dually eligible and you get Medicare covered services. Medicaid pays last after Medicare and any other health insurance you have. Similar to those who are not dual eligible, you have the option of going with traditional Medicare or enrolling in a Medicare Advantage plan. There are two types of dual eligibility: full and partial. Both are administered through Medicare Savings Programs or MSPs. Full dual eligibility means that the individual meets the criteria for Medicare as well as the requirements for Medicaid in their state. This allows them to receive not only the benefits conferred by Medicare, but also benefits covered by Medicaid that may not or are not covered by Medicare, such as dental, vision, and long-term custodial care. The Medicaid benefits available to those who are fully dually eligible can vary from state to state. I'll explain this a bit more in a minute, but those who have full dual eligibility fall into the MSP group with the additional signifier of plus. Partial dual eligibility means that the individual does not qualify for full Medicaid benefits, but based on income and resources, may qualify under one of the other MSP resource categories. Depending on the Medicare Savings Program for which they qualify, Medicaid will pay for some or all their Medicare Part A and B premiums and cost sharing. Because partial benefit dual eligible individuals do not qualify for full Medicaid benefits, these individuals do not receive additional Medicaid covered benefits such as long term services or supports. Medicare Savings Programs, or MSPs, are designed to help Medicare beneficiaries with low incomes pay for Medicare Parts A and B premiums and, in some cases, cost sharing. MSPs are managed by the Medicaid program in each state. Which program you qualify for, if any, is determined by your monthly income and how much you have in savings and certain other assets. These amounts change from year to year. Assets are a way of determining your financial worth, how much money and tangible things you have of value, but certain items are specifically excluded from the assessment. When Kentucky looks at your resources, they do not count the home you live in up to an equity limit of $752,000 in 2026, one car used for transportation, household goods and personal effects, burial plots, and up to $1,500 specifically set aside for burial expenses. There are four different types of Medicare savings programs. While these programs vary in terms of eligibility and benefits, they all help low income individuals pay for Medicare costs. Through Medicare savings programs, states buy in or cover Medicare Part A and or B premiums, and in many cases, Medicare Part A and B cost sharing for people who qualify. Even if you don't think you qualify, you should still apply. Your state will determine which program you qualify for, if any. Participants in all four programs are automatically enrolled into Medicare Part D Low Income Subsidy Program, or what is known as Extra Help, which helps pay for Part D prescription drug costs. It's important to note that MSPs are not the same thing as full Medicaid coverage. They help with Medicare costs, but do not necessarily pay for things that Medicaid covers, but Medicare does not, such as long term custodial care and supports. Qualified Medicare beneficiaries are those with the fewest assets. The QMB program helps pay for Medicare Part A and B premiums, deductibles, coinsurance, and copays with eligibility set at 100% of the federal poverty level. QMB is the most comprehensive MSP, covering all Medicare costs, including help with prescription costs. The next level is called Specified Low Income Medicare Beneficiary, or SLMB. This covers Medicare Part B premiums with eligibility generally set between 100% and 120% of the federal poverty level, and it also provides help with prescription drug costs. Neither this program or the ones that follow cover copays, deductibles, or coinsurance costs. The qualifying individual, or QI program, often called QI 1, helps pay Medicare Part B premiums for those with incomes above specified low income Medicare beneficiary SLMB levels, but below 135% of the federal poverty level. However, states use limited federal funds for this program, so it's limited to first come, first served. Those who seek QI assistance must reapply every year to remain in the program. Similar to QMB and SLMB, it helps with prescription drug costs. Lastly, the Qualified Disabled and Working Individual, or QDWI program, helps pay Medicare Part A premiums for people under age 65 with disabilities who lost their Social Security disability benefits and free Medicare Part A because they went back to work. To qualify, their income level must be below or equal to 200% of the federal poverty level. Income limits are based on a percentage of the federal poverty level. CMS has officially updated the resource or asset limits for most MSPs. For QMB, SLMB, and QI programs, these have increased to $9,950 for individuals and $14,910 for couples in 2026. These represent the maximum countable assets, like savings stocks and bonds, that you can have to qualify. This chart shows the benefits covered by Medicaid within the MSPs in table form, which is sometimes easier to understand. Note that MSP plans, which include the plus designation, provide full Medicaid benefits. Which plan a person qualifies for is primarily determined by income level and amount of assets. To review, QMB program. This program pays Medicare Part A and Part B premiums along with their coinsurance costs for individuals with an income up to 100% of the federal poverty level. QMB Plus. This group receives QMB benefits and full Medicaid benefits, full dual eligibility. Specified Low Income Medicare Beneficiary or SLMB program. This program covers Part B premiums for individuals with an income greater than 100% of the federal poverty level, but less than 120% of the federal poverty level. SLMB Plus. This group receives benefits under the SLMB program, along with full Medicaid benefits. Qualifying Individual or QI program. Medicare Part B premiums are covered for those with an income between 120% of the federal poverty level and 135% of the federal poverty level. There is also an annual cap on funds available for this group. Qualified Disabled Working Individual or QDWI program. Individuals who lost their Medicare Part A coverage when they return to work can buy back these benefits and have an income up to 200% of the federal poverty level. There is also a classification known as Other Duals. This group includes select cases such as medically needy beneficiaries in a nursing home who are not eligible for prescription drug coverage or individuals in a state's Pharmacy Plus demonstration. As I mentioned before, drug coverage for dual eligible individuals is primarily handled through Medicare Part D, but it is heavily subsidized by a program called Extra Help, also known as the Low Income Subsidy or LIS. If you are dual eligible, full or partial, you automatically qualify for the Extra Help program. This means you do not have to pay a separate monthly premium for your drug plan, and your annual deductible is usually reduced to $0. Even with Extra Help, you may still have a small copayment when you pick up your medicine. For 2026, the costs are capped at low rates. If you choose to join a Medicare Advantage plan, and as a reminder, Medicare Advantage is Part C and provided by private insurance companies approved by Medicare, there are special plans for dual eligibles. These plans typically include services covered by Medicare Parts A and B, as well as Part D or drug coverage. Special Needs Plans or SNPs. Medicare Medicaid plans only available in certain states and not in Kentucky. Program of All-Inclusive Care for the Elderly or PACE plans, and these can help certain people who would otherwise need nursing home care get services that allow them to remain at home. PACE is free for those who are dual eligible. PACE is available in Kentucky. Get more details about these plan types. You can go to www.medicare.gov/basic/cost/help/Medicaid. Today, we will focus primarily on special needs plans or SNPs. Special needs plans or SNPs are a specialized type of Medicare Advantage plan or Part C. While standard Medicare Advantage plans are open to anyone with Medicare, SNPs limit their membership to people with specific diseases or characteristics to provide more tailored care. Many dual eligible individuals have access to special needs plans or SNPs in addition to non SNP options. You can only join a SNP if you fall into one of these three specific categories: dual eligible or D-SNP, chronic condition SNPs or C-SNPs, and institutional special needs SNPs or I-SNPs. To qualify for D-SNPs, at minimum, you must meet the criteria for dual eligibility. While there are several different types of SNPs, here we'll focus on the one specific to those who are dually eligible for Medicaid and Medicare. These Medicare Advantage plans are known as D-SNPs. While beyond the scope of this presentation, there are 5 categories of D-SNPs. D-SNPs must include standard Medicare benefits such as all Part A and Part B services, medications, i.e., that which is included in Medicare Part D coverage. Like standard Medicare Advantage plans, D-SNPs can include extras such as dental, vision, hearing, or transportation to medical appointments. Key enrollment and cost rules. Provider networks. In most cases, except for emergencies, you must use doctors and hospitals in the plan's network. Specialist visits may require a referral. Continued eligibility. You can only stay in a SNP as long as you meet the specific condition. For example, if you are in a D-SNP and lose your Medicaid eligibility, you will have a limited time to switch to a different plan before being disenrolled. Costs. If you have a D-SNP, your premiums and out-of-pocket costs are often covered. More details can be found at the link noted on the slide. To quickly recap, if you are dual eligible, that means you qualify for Medicare and Medicaid. You must have Medicare Parts A and B. Your out-of-pocket cost, or how much you save, will depend on your income qualifications. You can choose to have traditional Medicare or Medicare Advantage. Traditional Medicare Savings Programs are known as MSPs. MSPs are applied for through Medicaid, and they help pay Part B premiums and often other costs. MSP approval means automatic extra help for prescriptions. Medicare Advantage plans for those who are dual eligible are known as D-SNPs and are available to those in MSP eligibility categories. If this sounds good, but you aren't sure if you qualify, remember that you have a free advocate. The Kentucky SHIP program has experts who don't sell insurance. Their only job is to help you. You can reach SHIP by calling 502-266-5571, or you can get information online at shiphelp.org. Thank you for attending our session on dual eligibility. Last step, please take our survey. It helps to show our funder that people are using this material and increases the chance that we will be able to continue to provide useful information on healthcare coverage in the future. If you are interested in staying up to date with the Asclepius Initiative, there's a lot of great information that we share on our monthly newsletter. Feel free to scan this QR code to sign up for that. We don't do anything with your information other than send you a great newsletter every month. You can follow us on the following social media sites. We're on LinkedIn, Facebook, Instagram, Blue Sky, and YouTube. If you need more information, we have you covered. You can go to asclepiusinitiative.org/toolkit or scan this QR code. We have a lot of amazing free resources on our website, and I encourage you to check that out. I want to thank the Kentucky Department for Public Health and their grant that lets us bring this information to you at no charge so that people like you and me can get the resources we need to better understand our healthcare coverage.